Welcome everyone to Pet's Best Friend. I'm Sam Lesante, your host, but the main man is Dr. Kathio, and you all know him. He's the veterinarian who really puts it all together for us here and throughout northeastern Pennsylvania, and for that matter, throughout the world, because you know we're seen on www.ssptv.com, and we're getting a tremendous response from people all over the world, and we appreciate that. Phone number for Dr. Kathio is 655-2412. That's 655-2412, 570 area code. My good friend, Dr. Kathio, how are you?
Thank you for having me here. I'm fine. Thank you for asking. How's everything with you?
Everything's coming along fine. You know, we're doing fine. The show, we're getting a great response from Pet's Best Friend. We educate.
Yeah.
Talking about educating, you know, we're coming into you know, in the season here, the fall and the winter season, and so what are some of the things that some pet owners should be thinking about?
The most prominent problem that I see in the winter is animal getting into antifreeze. Because the animals, they live outdoors, like some stray cats, or sometimes the dogs go outside. The water is frozen, and the people put antifreeze in the cars, and sometimes they change it on the roadside, or sometimes in their garages, the antifreeze, it leaks out on the floor, on the road, and it is kind of sweet. When the animal drink that one, it poisons them immediately, and it immediately start killing their kidneys. The sign and symptoms are that animal profusely vomiting. If you see a healthy animal profusely vomiting, might have been exposed to antifreeze, immediately take it to your veterinarian or emergency hospital, because it's an emergency. Now we have an antidote, you know, we can give it to them and reverse some of the function if it's not already damaged, is absorbed or something. So that is the most commonly things that happens in the winter.
Then of course we got you know, the cold weather. Yeah, and sometimes people forget that dogs and cats and animals get cold.
Right. Some animals, you know, if they are kept outside, you know, they are used to change in the weather. The animals, they are kept indoors, and all of a sudden they are exposed to the drastic, severe weather. They get a frostbite, and they get pneumonia, and they get hypothermia, all these problems. So if severe winter comes in, make sure your indoor animals have the sweaters to put on just to take them outside. Like husky and Alaskan Malamute, they are used to the cold temperatures.
You know, we talked about you know, when people are considering to get pets, okay, and first of all, two things. People who already have pets. Taking them to the veterinarian, it's important. It's just like you going to the doctor at least once a year. Yeah. And some of the things that, you know, for those people who have pets that, you know, there's nothing wrong with my dog, or my cat, you know, why should I take him to a veterinarian? What's wrong with that thinking?
Pets, you know, like it's good to have pets. The pets carry certain bacteria or carry certain fungus that might be communicated to people, or even worms. They can be contracted by the toddlers. There is a intestinal worm of a dog, like a roundworm. We call them roundworm, and Toxocara canis is the name of that worm. If your dog is harboring that worm, and somebody has a low immune system, or they have a toddler in the house and get into the mouth, and it can be transmitted to people. And if the animals have contracted the ringworm, which is a fungal disease, and can be contracted to people. And there are like other parasites, like mange mites. It's in the skin, you know, animal get a skin pruritus or itching of things. You can get to the even be transmitted to human beings as well. So these are the zoonotic diseases. Another thing is that there are certain hidden things that you may not know that the animal has. For example, a horse. You know, this is an animal show. Horse can have atrial fibrillation and heart rhythm problem, And if he doesn't have an examination, if the jockey sits on it, goes into the racetrack, and he have the horse into the race, and the horse's heart can suddenly stop and can throw the jockey on the floor, and a death can occur. Or another thing is that even in the dogs and cats, if there is some problems with the oral cavity, like for instance the young animals, they are just they are young, sometimes they have a retained canine teeth, and they become abscessed and cause a problem to the dog. Or if they are not cleaning their teeth routinely, the dogs and cats' teeth should be cleaned every 6 months. And when they come to examination, we identify the early problem, and if it's caught early, we save these teeth. And the animal would not have later on problem with the chewing or chewing their food. If these animals have a bad teeth, it's not only give you a bad breath and bad look, but the bad teeth in the animals can affect their heart. The bacteria gains enter through the gum into the bloodstream, and when it goes through the myocardial like valves, it can deposit in there and cause vegetative myocarditis. The same bacteria from the bad tooth can go into the liver and go into the kidney and shorten their lives. So routine examination, we pick these things up.
I was just going to say, the fact that if you keep a good maintenance of your pet, I mean, we don't have a magic wand to say how long a pet's going to last. But I think the rule of thumb would be that if you're taking your pet to the veterinarian every 6 months and doing what has to be done, and you're having the teeth clean, etc., I think you got a couple more years with that pet to last.
Exactly, extra years. I give you an example that I had a dog yesterday in my office, and they said this dog got sick, and when the dog came to me, the dog's kidneys were 90%, 95% already gone. Was living off like 5% of kidney, and at that time, it is too late to act. And at that time, you need a dialysis or need a kidney transplant, and at that, it's not feasible. Other things I am seeing in my area, the dogs are getting leptospirosis. If you have a pet, just check to see if your dog has received the vaccination for the leptospirosis. I had a few dogs last week who were positive for the leptospirosis. It's a vaccine that is available, and if your dog has not received the vaccination, ask your veterinarian that he might look at your records and see that your dog might need a leptospirosis. And same way, the Lyme's disease is prevalent in this area as well, and we have a vaccination available for it, and we can save the life of animals from like saliva of animals, and prevent getting the Lyme's disease by giving them the vaccination. And another trend that we see people call on the phone and ask how much you charge for the vaccination. Like there are so many vaccination, like are you, instead of asking, what vaccinations are required, they call and ask, how much you charge for the vaccination. They are shopping for the low price. So one office may tell them, few vaccination, another office may tell them more vaccination. So they will automatically pick the few vaccination and just put
that boils down to the credibility of the veterinarian, okay? And I think, when you have to shop around, I think it's very important. As I said, if you're looking for a doctor, a specialist, if you're looking for a dentist, if you're looking for a lawyer, if you're looking for anyone to provide, always check your credentials, always check their reputation. Of course, you've been on the website, your reputation speaks for itself. But there are a lot of great veterinarians around.
Many great veterinarians.
Yeah, in northeastern Pennsylvania. And there's been times where I hear the stories where that's all they're concerned about is making money. Okay. Well, I know that's not the case with Kathio, okay? I know that for a fact, the many years that I've known you. And that's a shame, Doc. I mean, I think what's happening is there's some bad veterinarians out there who just want to gouge people for no reason whatsoever. And there's only a few of them, okay? And those few make it bad for good veterinarians like you and the good veterinarians we have in northeastern Pennsylvania. And so I say to those people, when you find a veterinarian who is gouging you and doing that, don't even go to that person, okay? And I'd like to know about that person's name, because I will personally call that person and say, look, you know, your job is to take care of animals, just like a doctor is to take care of persons. We all have to make a profit. There's no question about that. But I think some people are so offended and feel so bad, they can't afford to take them to veterinarians because some of them really overcharge them for no reason. And you know, it's hard to get, not hard, if you do your homework and you check your veterinarians out in the veterinarian hospitals, I think you'll know who are the credible ones. Am I correct?
Most likely the veterinarians are not going to do charge so much. Sometimes there is lots of overhead. Like if you are a veterinarian, you have endoscope with you, you have a X-ray machine with you, you have a blood machine with you, you have all the amenities available for your client.
Yes.
And all those things require maintenance, so that sometimes the price,
and that's built in.
You know, the price might go high or something like that. But again, you know, like in all the professions, you know, there are goods and there are bad. Yeah.
Well, especially with, I mean, when you don't, a veterinarian's a special person, because you know you have to. The dog can't tell you what's wrong with them. The cat can't tell you, or an animal. You have to find that out. I just feel that, you know, we have very good veterinarians in northeastern Pennsylvania, but there are a few of them that are just bad. And I wish we could eliminate them, as we have a couple doctors that are bad. I wish we could get rid of them, you know, because they make a bad name. I know exactly what you're saying. We have with our cameras, you know, the $50,000, $60,000 a piece. Well, when you're going out doing production and you're going out, you're giving people the quality, all right? Well, not that you know, so you have to build in a charge. And still, your rates versus the rates in big cities are extremely good. Listen, I'm talking to Dr. Kathio, folks, Pet's Best Friend, 655-2412. Now, for low-cost spay and neuter, you could 821-9390. Low-cost spay and neuter for the clinic. It's 821-9390. When we come back, we have a cat. He'll be showing you a cat who had a hip fracture, a tiger cub. What was wrong with the tiger cub?
Osteoporosis, bone problem.
And he'll tell you what he did for those animals right after this break. Stay with us. Welcome back to Pet's Best Friend. Dr. Kathio is here, folks. He's the main man, 655-2412. Doctor, now you have a cat here who has a hip fracture.
Correct.
Let's talk about this cat.
First of all, this cat come to me after went to several different places, come to me because they know that I'm good in the community. Cat had a fracture. The fracture is one problem. Another problem was finances. People had no finances. Now the cat with the fracture thing, with the 2-3 children, they love animals. Sometimes you say, if you don't have the money, why you have to have animals? These children of the poor families, you know, children of the low socioeconomic family, they need to enjoy the animals. Then what I do in my community, I try to be like helpful. I wish I can be helpful to everybody, but at that time I had the provision. I told the people, bring the cat in there. I examined the X-rays. They already had the X-ray taken someplace else. I saw that there was a fracture of a hip. Hip fracture can occur due to trauma, and it can occur also due to hereditary problems. It can also occur due to improper nutrition. Improper nutrition, what is that? What is that related to the bones? Like sometimes the kittens, you know, they are not 6 or 8 weeks old and people put them on the meat diet, like give them a canned food and meat diet. What does that meat diet do to those bones when the animals are growing? It has a high phosphorus content, and less calcium. So what happens that bones become brittle when they jump or fall a little bit and they break hip, or they break mid shaft of the bone. In this case, the cat jumped and the hip was so fragile that hip got fractured. What I'm trying to tell you that, make sure that to give kittens the kitten formula. If the mother is not feeding them up till to 6 to 8 weeks until the 6 to 8 weeks after age, don't 2 weeks kitten you find him on the street and bring him down and start giving him the meat diet. That will have an effect on the musculoskeleton and the growth of the especially on the bone. So what I did there, I told the people not to worry about it. They were concerned, they have no money. The little kids looking at me that he's going to put our cat to sleep or something. I told him not to worry about it. So I help in my community and went and I'm performing the surgical procedure. And you are looking at the surgical procedure on the video that it can be fixed and cat can be brought back to normal. And give the cat back to the people, and it's great to see the animal couldn't walk before, he's in lots of pain. You have relieved the pain from the animal and make them walk again, make the kids happy or something.
Happy, yeah.
So this this was the problem of in my community and the cat. Not only that, but I also very active representing the America's softer image to the foreign countries. Again, I had a meeting with the Senator Robert Casey, Honorable Robert Casey, and we discussed how we can, bring America's more softer image to the foreign countries. Mm-hmm. And he was grateful to me that, I do personal diplomacy and bring America's good views to the foreign countries.
Now you remember the press club as well?
I'm the member of the Thanks to You.
Wow,
thanks to you, I'm a member of the National Press Club in Washington, D.C.
Very prestigious.
Yes.
Well, you don't get in there because you don't do things.
Yeah.
So this cat is all right now.
Cat is doing very well. Cat is
now
doing
we have
well.
a tiger cub.
Tiger cub.
Okay, osteoporosis.
Osteoporosis. You see this poor tiger cub in the video is not able to use his hind legs because they're so painful. Not only painful, but also this tiger cub had fractures on both legs. Nobody beat him up. Why does he have a fracture? This tiger cub was given early meat diet.
Same thing.
Early meat diet, and you look on the radiograph. I look at the arrows on that one. I'm showing you showing the fractures. So what is the prognosis when they have? It can be fixed if you improve the diet, and with the proper diet, in the long run, that can be fixed. Mm-hmm. So you put them back on the diet that has more calcium and less phosphorus, and can be fixed. And the osteoporosis can also occur if the mother is bad and has rejected the offspring in an early age. Then and they have not got enough colostrum. It's very important when the baby is born, takes mother's milk. For right away, the more early it takes the mother's milk, the more good nutrition and immunity these animals get built up. In this poor tiger's case, the mother was bad and just rejected, doesn't want to give milk to the tiger cub.
Tiger cub doing okay?
Tiger cub is doing very okay.
Folks, I'm talking to Dr. Anaya Kathio. It's Pet's Best Friend, and you can watch us 24/7 on ssptv.com. If you have any questions or comments for Dr. Kathio, his phone number is 570-655-2412. We'll be back right after this. Welcome back to Pet's Best Friend. I'm Sam Lesante. The main man here is Dr. Anaya Kathio, veterinarian. Remember, this guy was brought over, works with the United Nations, works all over the world, teaching people how to keep their pets safe and healthy. Now we have two other guests on the show. We have a cat who has a gastric tumor. What's the story about this the cat with the gastric tumor?
The cat was brought to me that the cat was not eating, and people said that the cat has a hairball. Why cat has a hairball? Because cat's been throwing up for a long time. It can happen if the cat has a hairball, they try to regurgitate and bring the hair out from the stomach and throw up. But if your cat is throwing up and is starting to lose weight, then there should be concern. And in this case, cat looked very alert, very bright and everything, but is starting to lose slightly weight. Then all of a sudden, it started, losing rapid weight and the vomiting, like people notice probably hairball or something like that. At that time, you take the cat to the veterinarian to see what's going on with this cat. Weight loss and vomiting, that is a strong indicator that there is something serious things going on in pets. Weight loss in animal occurs due to like two major diseases. One is the diabetes, another is a kidney disease. And these two, these are two main causes of weight loss. But the other causes are neoplasia or tumor, or something is happening in the body that body is not absorbing the nutrients. And something is going on. So in this case, he suspected that it is more than this cat has more than a hairball. Starting to immediately started the radiograph because I felt something in the stomach. In the stomach, it felt like a lump. It could be a stool or it could be a tumor or mass. I felt the cat had a little mass in the abdomen. Did the radiograph because losing weight, so also was giving indication might have a tumor.
Yeah.
Did the radiograph, as you see on the video, and there was a mass right in the stomach. I got the permission from the owner. First of all, you see on the X-ray the arrow pointing to the tumor. I got the permission to go in and visualize and take some sample out. You're looking on the video, I'm taking the sample out. I took a small piece of sample and there were lots of adhesions and other things. I remove, fix all those things that to small piece I took from the stomach and send it out to the laboratory, send it out to the pathologist. And the pathologist gave me the report back within few days that this cat had a lymphosarcoma and a gastric mass was a tumor of the stomach in a cat. And now what happens when you have a stomach tumor in the cat? You can put cats on chemotherapy or treat them symptomatically for the vomiting or give a cortisone shot. It depends on the clients and depends, what age, how old is the cat or something. Then you can decide what you want to do with these things. But cancer, lymphatic cancer is prevalent in cats, it's significantly prevalent in cats. It can happen in 6 months of age, it can happen in 15 years of age.
Once again, it's always, going back to the beginning of our show, bringing your pets to the veterinarian to get them a checkup. It's always good to know what's going on to prevent. You don't know what's going to happen, but at least you have a good shot at it. Mm-hmm. Doctor, it's always interesting talking to you, and I appreciate the information. Anything in closing you'd like to say?
Please, try to learn something more about your pet, medical wise, nutritional wise, and environmental wise. How to keep a puppy or how to keep a kitten in the house, how to take care of them. They require like nail trimming like you do. They require shampooing, go to your groomers. They require good grooming. They require good dental care and immunization, and enjoy your pets.
Thank you very much. Dr. Inaya Kathio, folks, Pet's Best Friend, 570-655-2412, or if the low-cost spay-neuter clinic, it's 821-9390. That's 821-9390. I'm Sam Lesante. You can always contact me at sam@ssptv.com. Remember, 24/7 at ssptv.com. Just hit shows, Pet's Best Friend. You're going to watch this anywhere in the world. We'll see you next time.